How is Trichomonas vaginalis different from bacteria or viruses? Imagine a tiny organism causing discomfort and infection, but not quite fitting into the usual categories of germs we hear about. That's what makes Trichomonas vaginalis unique. It is a single-celled parasite, which is very different from bacteria and viruses. Bacteria are tiny living organisms that can survive and reproduce on their own. They are prokaryotic, meaning their cells are simpler and lack a nucleus. Viruses, on the other hand, are much smaller particles made of genetic material wrapped in a protein coat. They cannot reproduce or carry out life processes without invading a host cell. Trichomonas vaginalis is a protozoan, a type of eukaryotic organism, which means it has a more complex cell structure with a nucleus and other organelles. It is capable of independent movement using whip-like structures called flagella. This parasite causes trichomoniasis, a common sexually transmitted infection. It mainly infects the urogenital tract, living and multiplying there. The way these organisms infect people also differs. Trichomonas is transmitted almost exclusively through sexual contact, infecting both men and women, though symptoms are more common in women. Bacterial sexually transmitted infections like chlamydia or gonorrhea are also spread through sex but involve bacteria. Viral infections such as HIV or herpes are transmitted through sexual contact or bodily fluids and often have different patterns of infection and symptoms. Symptoms of trichomoniasis include a frothy, greenish vaginal or urethral discharge, itching, burning during urination, and discomfort during sex. Some people may have no symptoms at all. Bacterial infections can cause similar or different symptoms depending on the bacteria involved, while viral infections often cause systemic symptoms like fever or sores and can stay in the body long-term. Diagnosing trichomoniasis involves laboratory tests that look for the parasite, such as microscopy or specialized DNA tests. Treatment is specific to the parasite and usually involves antibiotics like metronidazole or tinidazole. Bacterial infections are treated with antibiotics targeted at bacteria, and viral infections may requiring antiviral drugs or supportive care. Biologically, Trichomonas vaginalis is a motile protozoan with flagella that help it move through the urogenital tract. Bacteria reproduce by splitting into two cells, a process called binary fission, and may or may not have flagella. Viruses reproduce by hijacking the machinery of host cells, making new virus particles, but they do not move independently. In summary, Trichomonas vaginalis is a parasite that causes a sexually transmitted infection through direct contact. It has a complex cellular structure, moves with flagella, and requires antiparasitic medications for treatment. This makes it quite different from bacteria, which are simpler, and viruses, which are even smaller and relying on host cells to reproduce. Understanding these differences helps in accurate diagnosis, effective treatment, and prevention of trichomoniasis and other sexually transmitted infections. Always consult healthcare professionals for personalized advice and proper testing.